Okay, hello everyone. Thank you for joining us. Today we are going to talk to you or give you some information about phlebotomy. Amidst of this pandemic that our country and our planet is going through, we still wanted to make sure to um, have some information for you, provide you with career options, and we just want to be as normal as possible. And I want to thank DHR, who has always been amazing, a great partner, and providing all of these opportunities for students and for educators. So here today we have Beatriz Snell. She's a supervisor at DHR Health Laboratory, and she's going to be talking to you about her career and everything about phlebotomy, which is a pretty cool career to have and very interesting. So, Ms. Beatriz, Ms. B, I will hand it over to you. And also, I want to go ahead and thank Region 1 Education Service Center for providing these opportunities for the students of our region. And my name is Isela Herrera. I'm the education specialist working with this project, PATHS project, which is finding pathways aligned to health sciences. So this is, of course, just one of probably hundreds of careers that anyone can find in the healthcare field. So Ms. B, without further ado, I will hand it over to you.
Okay, good morning, everyone. My name is Beatriz Snell, and I'm the phlebotomy supervisor here at DHR Health Laboratories. This morning, I'd like to show you a little bit about phlebotomy. Right now, currently, I oversee 45 phlebotomists in the hospital. Basically, their duties here in the hospital is day by day. You know, they are assigned a certain floor in the hospital. We here in this hospital, we have newborns, adults, and geriatrics. So each phlebotomist is assigned a different floor, and they are to go room to room collecting patients on a daily basis. So let me tell you how I started with DHR. I started with DHR 8 years ago, and I was a phlebotomist. I did phlebotomy for 5 years for DHR. Previous to that, I had about 20-year phlebotomy experience in other facilities. I started here, as a phlebotomist. I was assigned to several areas. The hospital also has outside labs, which is our reference lab. So what those phlebotomists do is they work from doctor's offices. And of course, the hospital provides a phlebotomy services for those particular doctors. So I started with a reference lab, like I said. I was there for 5 years, and with my experience and, of course, my hard work and my knowledge, I was able to move up to a phlebotomy supervisor, and I've been doing phlebotomy supervising for 5 years. I'm also a nurse. I have a degree in nursing. I am pending to pass my boards, which I'm working on. Right now I'm at a point where I love what I do. So now that I have my nursing degree, I'm kind of debating, do I stay in the same field? Do I go explore a little bit more because now I have a degree? But I don't know. I keep on telling myself I've done phlebotomy for over 25 years. So I love phlebotomy. So I'm kind of debating whether to stay, move on, or what. But so enough of me. So let's get down to what we do here at the hospital as phlebotomy. So let's get started. Let me see. So first of all, right now, of course, with the pandemic going on and all that, we implement more hand washing and everything than ever before. But of course, for phlebotomy, you have to either hand sanitize or wash your hands all the time. You can go ahead and go to a patient's room and hand sanitize and, start your venipuncture procedure. Then you can go to your next room and then wash your hands and so on and so forth. But what we do recommend to wash your hands all the time with is, I don't know if anybody knows, but here in this hospital, we do blood cultures, which are these bottles that you see here. For these, every time that we draw blood cultures, even if we have a patient back to back, we need to make sure that we wash our hands every single time. Just because it needs to be very, very, very clean surface. We don't want to cause a false contamination. Okay, so the very first thing that you do, of course, here in the hospital, if you are in the hospital and you're going to draw a patient, the first thing that you need to do is you need to, of course, if you're assigned to a floor, like I told you, and you're going to go into the patient's room, what you do is you knock the door, and you walk in, you identify yourself with the patient, and you identify your department that you're coming from, and then you proceed to your venipuncture collection. So, of course, I hand sanitize my hands, or I wash my hands. Then you go ahead and you don your gloves. You get your supplies ready. We have different tools here to draw blood, which is our vacutainer method, our syringe method, and our butterfly method. So what you want to do is, basically, the phlebotomists that are in the hospital, they kind of know their patients already. They kind of know if a patient is a difficult patient, because sometimes patients are here, for extended stay. So sometimes when you walk in the room, you're like, okay, I did this patient yesterday, and you remember, okay, it's a little bit more difficult, so this is the method that I'm going to use. We have the vacutainer method, which is here, in the image that you see here. Okay, and for some reason, the patients prefer the butterfly method. For some reason, they've been told that the butterfly is painless, that it hurts less and everything. So a lot of patients will tell you right off the bat when you walk in, can I have a butterfly? Because I'm a heart stick. Or because, I want the smallest needle because my veins are very, very, very small. Whatever reason it is, always make sure that you listen to your patient and that you don't ignore your patient, because for the most part, they know their veins, they know what they're talking about. So let's try not to ignore the patient. Okay, so let's say another thing that you need to know while you're drawing is there is a certain order of draw. Here in the hospital, we have different types of tests, which will be maybe our PTT, our chemistries, or our hematology orders. Any orders that you have, every tube that you see here has a different additive. And just what you see here is, this is the order of draw that you want to draw in case the patient had multiple test orders. If the doctor ordered several tests, that doesn't mean that all tests go in one tube. Every test has a different color of tube. Every facility has a different way of identifying or letting you know what color tube you need for what color of test. So here at DHR, we use handheld dolphins. Our handheld dolphins is a device that we use to scan the patient's bracelet. We scan the patient's bracelet. As soon as we scan the patient's bracelet, on our little handheld device, everything will appear on there. It'll appear, patient's name, patient's date of birth, and what test the patient is going to be needing. So once you see that on your screen, what's cool about that screen is that if it tells you the patient needs a CBC, right next to the CBC, it will tell you lavender. So you'll know that a CBC is a lavender, which is this color tube here. So it kind of makes it easier for us to know what color tube to draw for what test. So let's say that I walked into the patient's room, like we just talked about before. I've already identified myself. I come and I scan my patient, and when you're scanning your patient, that is when you ask your patient, can I please have your name and your date of birth? Sir, ma'am. And they will, you know, they will tell you, okay, Maria Salinas, 12/26/75. Okay, so then at that point, you get your handheld device, you look at it, and you make sure that everything matches. And the reason you do this is because you don't want any mislabels. You don't want to be drawing the wrong patient. Okay, so it's happened before. Not everybody is perfect, and it's happened before to where we scan the patient, we ask the patient the name, and it's something different. So at that point, you stop, you go, and you contact your supervisor, and you do whatever you have to do to make sure that everything is corrected before you make a mistake and you send erroneous results to the lab. Okay, so now let's go ahead and proceed with the venipuncture collection. We've already identified our patient, right? So now what we do is we're gonna go ahead and get our tourniquet, and we're gonna put it around the patient's arm about 3 inches above the middle area, okay? So you're gonna go ahead and put on your tourniquet. Okay, let's say we're gonna use the vacutainer method. So this is our vacutainer method. You go ahead and remove the cap here. This gray little rubber is your needle, so you're gonna stick it in here. But this is the needle that's gonna go in, the tube is gonna go in here once you apply your tube. The needle that you're gonna use on the patient is this one here that you see here. You're gonna lift this up. This is your safety guard, okay? And this is your actual needle. So you're gonna remove the needle once you're ready. Okay, let's say the patient is gonna have a chemistry study and a hematology study. So if we look at the order of draw, the green must go first and then the lavender, okay? So now you get your alcohol and your swab. And you feel to see where you feel the vein, okay? So, okay, I feel one here. So you're gonna go ahead and clean the area, okay? At this time, you're talking to your patient and you're asking your patient. You kind of let it air dry so it won't stink the patient once you do your venipuncture. You're talking to your patient, you're asking him, it's not too tight, sir, are you okay? And he'll say, yeah, okay. Then you proceed with removing your cap for your needle, okay? So you feel again, okay, there it is. Then you gotta make sure that your bevel is up. If you see that, that is your bevel, which is a little opening. That needs to be up. You can't do it the opposite way. It's gotta be up. Okay, so you go ahead and feel, okay, there it is. There you go. You go anywhere from 15 to 30 degree, okay? Then what you do is you hold your hub in place. You don't move it. You don't move your needle. And then you just insert the tube. Once you see the blood flowing, you wait till the tube is full. Once your tube is full, you remove it and make sure you secure this. If you see, I have my finger in the patient's skin and the other one is on top, and it's kind of holding the hub in the middle, so you won't have any movement and it won't hurt your patient, and you won't stick in the needle more than what you need to, because sometimes if you stick it too far in, you pass your vein. So you gotta hold it tight, remove it, and make sure that you invert the tube a couple of times, because like I said, remember, every tube has a different additive in there, and we gotta make sure that it's inverted so that we won't get any false results. Okay, so you set it down, and now you're ready for your next tube. So you do the same thing, you stick it inside. Make sure, you see how these tubes have a label and then they don't have anything in the back? Make sure that you push it in with the no label visible. That way you can see the flow of the blood when it's coming. You see it coming, okay, then you remove it. Then what you want to do is remove your tourniquet. Your tourniquet has to always be removed before you're done, okay? You remove your tourniquet, you place your gauze over, you remove your needle, and make sure that you use your safety lock. This is your safety lock so that you won't poke yourself. As soon as you're done, you should have your phlebotomy cart, which is what we use here at the DHR, close by you, or the sharps container is always at bedside from every room. So you always make sure that you get rid of your sharps as soon as possible. Okay, so you apply pressure on the venipuncture site. You hold it for a couple of seconds. You assess your area to make sure that the patient is not bleeding, because we have some patients that are on blood thinners and they might bleed, and those might need for you to hold it for a little bit longer before you can actually put your tape. Always make sure that you assess the area, because it's very important. You don't want to walk out and then your patient bleeds out and the nurse doesn't find out till later. Okay, so you want to make sure you assess the area, it's good, then you're ready to apply your tape. So that's basically what you do for a phlebotomy draw. Like I said, it's very important for you to remove the tourniquet before taking out the needle, and let me tell you why. The reason is, if you don't follow the policy that we have here in DHR and you remove your needle first, chances are, if somebody gives you a call and you're hearing your phone going on because you have a collection next door, you're gonna forget it and you're gonna leave the tourniquet on the patient. So that's why, if you follow policy, you should not be in that situation. So that's why, like I said, it's very important to remove it before you remove the needle, because like I said, chances are you'll forget. You're in a hurry, you're getting all your stuff ready, you're making sure that you're labeling your tubes and all that good stuff. And if you didn't follow the right process, chances are you're not going to pay attention that the tourniquet is still on, and that can be very harmful for the patient. Does anybody have any questions? No question.
Can you talk a little bit about the difference between several patients? So this would be like an adult, I assume, the arm. What about like your pediatric patients?
Okay. So let me tell you, with a pediatric patient, it'll be a little bit different, because you always have the challenge of they're gonna move around, they're not gonna stay steady and stuff. And sometimes what you have to do with pediatrics is, with one arm, you gotta secure their little arm and work with your other hand, with your dominant hand. If you're lefty, with your lefty. If you're right-handed, with your right hand. Okay, that be the only difference with pediatrics. And of course, with pediatrics, we do not use the Vacutainer method. We use the butterfly method. And the butterfly method, this is a hub which has a little connector here that goes connected with the butterfly. So what you do is, this is your butterfly here. You remove this little needle portion. You put it in your sharps container. You attach this, make sure that it's secure so that the blood is not gonna come out through here. So once it's attached, let's go ahead and show you how we would do it with a pediatric. So let's say that this is a pediatric here. So we come in here, and of course with pediatrics, if we have to sing a lullaby to them, we're gonna have to, to calm them down a little bit. It's a little bit different. Some will be very brave and they will let you do it with no problem, but there's others that will give you a little hard time. So what you have to do is, okay, you applied your tourniquet, you're gonna apply your alcohol, you're gonna feel for the vein. So let's say once you rub that alcohol, they start jumping, crying, moving around and everything. So what you have to do, like I said, is you have to secure their arm. You kind of apply pressure, you secure their arm, and you start doing your venipuncture procedure. So you kind of let go a little bit so that you can get your needle. Of course, again, the bevel up. Let's say the patient is going to have a CBC. So this is the tube that you would use for your CBC, the lavender. Okay, so you get everything ready. You apply pressure, like I said, to their arm so they won't move. With your arm over here, you're going to kind of set your elbow in their little arm so they won't move at all. You search for your vein. Okay, here's my vein. This is what I'm going to use. Then this is what you do. You go ahead and insert your needle, and once it starts flowing, you see it flowing, okay, you can kind of go ahead and loosen this up and then just go ahead and insert your tube. And then once you see the blood flow, it's coming, it's gonna be okay, you calm down. Look, it's not hurting you anymore. That's it, we're done, we're almost done. You kind of reassure them that they're gonna be okay, that that there's no more pain or anything. And you see what this is full already. Okay, so you kind of remove it, make sure that you invert it. Okay, and then you go, okay, so we're done. We remove our tourniquet, and the same thing, you just put your gauze over, you remove your butterfly, and this one here, right over here, if you see this little black button there, it's to retract the needle for, it's a safety net, okay? So you won't poke yourself. So you just press there, and look at how it's gonna automatically go inside so you won't poke yourself, okay? So once you're done with that, make sure that you put this in your sharps container. You hold the area, you assess the area, no more bleeding, then you're ready to tape it up. Does anybody have any questions as far as the butterfly method?
There is a question about how much schooling it takes to become a phlebotomist.
I'm not really sure, because there's different programs out there. There's programs that maybe it takes 3 months. There's others it takes 6 months, depending on what program you choose out there. I know there's several schools that have that. I'm not really sure on that one right there, but I know that, like I said, there's several schools out there that are offering the program. DHR is also offering the program. I'm one of the instructors in the program, so anybody that wants to come over is welcome. Yeah, and I think our course is about 6 months, isn't it? Yes. Yeah, our course is 6 months.
Awesome. Would you happen to know what the salary is for a starting phlebotomist?
The salary, that goes through HR, and it usually depends on your experience and your credentials. Everybody, but I believe that right now, I want to say it's $13.
So as a phlebotomist, you only draw blood? Are there any kind of other specimens that you would be involved with? Okay, as a phlebotomist,
basically your main function is venipuncture collections all day. That's all you do. You go room to room collecting patients. We do have an outpatient lab at the hospital that I do also have phlebotomists in there. Those phlebotomists, it's patients that are coming in for surgery, and it's considered an outpatient basis. Now those phlebotomists, they do a little bit of their scope of practice is a little bit different. So what they do is the patient comes in, they register the patient, they draw the blood. So sometimes the doctor will order a flu swab, or will order a stool sample or a urine sample. So at that point, we do give the patient the appropriate containers that they need for those specific tests.
Okay. We have a question. Is there an easy way to remember the order of draw?
Is there an easy way to remember the order of draw? Well, not really, but I do. It's gonna sound kind of funny, but I guess in every facility that you work, they will try to implement and make sure that you follow the order of draw on a daily basis. As far as on my side, I created some little bracelets that my phlebotomists wear. Not all of them wear it all the time, but they were all issued. And of course, I made it myself at home. Just one day I was bored and I said, what can I do? Because I would walk in several times and I would catch my phlebotomist kind of like thinking like, oh, which one's first? This one or this one? Like, because sometimes you're in a hurry and stuff, and sometimes you can forget. So I said, how can I improve them, a easier way, like you just asked right now, for them to remember. So I was bored at home one Saturday and I started making little bracelets with the little rhinestones. And I just, the way you see here, blue, red, mustard green, the lavender, the pink, the white, and the gray, I put the rhinestones in order, and I issued them out to my phlebotomist. And I told them, you have to wear this every single day until you tell me that, that even in your dreams, your order of draw. So this is what I did for my people. So some of them still wear it, some of them don't. Some of them have been with me for many years already, so they already have it down, so they don't need to wear it. But yeah, this is what I did for my people. And I thought it was pretty cool because everybody they were like, oh my God, like freaking out when I told them, guys, make a line because you're all going to get an order of draw bracelet. And the guys told me, I have to wear that? Yes, you have to wear that. Not unless you tell me that you already know your order of draw, like with your eyes closed. And they're like, okay. So yes. But I mean, you can always try to find, easy ways for you to remember. I mean, I know that I've heard some phlebotomists say that they have like a little song for the colors, and that's the way she remembered. So everybody, learns in a different way, and everybody does different things to remember. So.
There's a follow-up question to how much schooling it takes. The question is, how much schooling did it take you to become a phlebotomist?
It took me a year, and I'm talking to you. It took me a year to do my phlebotomy course, and this was back in, I'm not gonna tell you exactly the date because then y'all are gonna figure out how old I am, and I'm old. No, it was back in 1999, and that there was a medical assistant school that I went to, and it was requiring for us to, it was a whole year. So we went for a whole year. So I am a registered medical assistant, and in the medical assistant program, we covered phlebotomy. So that is the school that I went to, and that's how I got prepared to do my phlebotomy skills.
So of your staff, are most of them just phlebotomists, or are they also MAs?
I would say 95% of my phlebotomists are certified phlebotomists. I have very few medical assistants.
What type of courses did you take is another question.
Well, in my phlebotomy, I took anatomy, I took chemistry, I took hematology. It was so long ago. But yes, I know that I took phlebotomy for sure. But yeah, like I said, I took clerical, which I don't know what clerical has to do with it, but yes, I took clerical. I don't remember specifically like what courses I took, but you know, I know that we took chemistry, and we took hematology and anatomy and all that.
There's a question. Are there special precautions for phlebotomists now due to COVID-19?
Yes, the phlebotomists are, of course, you know, the best precaution that we can take out there is hand washing. So hand washing is very, very important. So hand washing, of course, yes, our phlebotomists they need to make sure that they have proper PPE before walking to any contact isolation room that we might have. And of course, they're protected with their N95 masks.
Can you talk about other professions that a phlebotomist interacts with on a daily basis or in special circumstances? Do they interact with nurses?
Yeah, okay. So a phlebotomist, you know, you interact with physicians, you interact with nurses, you interact with clerks, with, you know, whatever, with all the staffs that you deal with every day in a hospital. So yes, you know, sometimes you walk in the patient's room and the doctor might be there, and sometimes we have, you know, some doctors out there that say, you know what, I want to see the way you collect the blood cultures, because I want to make sure, which again are these little containers that we have here. So sometimes the doctor will say, I want to see the way you collect a blood culture. I want to make sure that you're not contaminating the blood culture before it even goes to microbiology to be tested. So, you know, sometimes, you know, the doctor will be there, and he will be, you know, all eyes on you and making sure that you're following the process, you know, and stuff like that. We also have nurses, you know, sometimes that we have critical patients here. We have the ICU unit. So some of these patients have IVs in both arms. So we got to make sure that if we have a collection for that type of patient that is in a critical area, there is certain lab tests that whatever fluid they're receiving may affect the result of the specimen. So you got to make sure that at this point you communicate with your nurse, and you let your nurse know, okay, well, I'm walking in here because this patient is going to have a PT-PTT, which will be this blue tube right here. You know, and you walk in the room and you see that your patient has IVs running on both sides. You got to make sure that you communicate with your nurse, and you have your nurse stop the fluids before you draw. So in this situation, let's say you walk in a room and the patient has IVs on both sides. The nurse has to stop the site that you're gonna do your venipuncture procedure on for about 10 minutes. So the nurse will, if you have another patient, you can go and do your other patient, come back. At 10 minutes, you know, you draw your blood. You got to make sure that you always have to discard at least 5 mLs of blood, because of course, you know, there's going to be fluid in there. And if there's fluid in there going to the tube that you're actually collecting, the results may be false. Okay, so you need to make sure that in those circumstances, you know, the process is a little bit different due to the fluids that the patient is receiving.
We have a question. Are blood donation staff phlebotomists? Would you happen to know? There are blood drives that happen. Those that draw the blood, would those be phlebotomists? Would you happen to know?
I believe so. Yes. As a matter of fact, I have several of my staff that have worked at the United Blood Services or at other facilities, and they worked there for a couple of years, and they applied here with me, and now they currently work for DHR. So yes, they do get a lot of experience there because they are connecting patients. So it's actually a venipuncture collection.
What about plasma?
The plasma center is the same thing.
We have another question here. How many patients would you draw blood from in a typical day?
On a typical day here at DHR, our volume is very high. So here, our morning run consists of drawing blood on every patient that's in the hospital, basically. My phlebotomists come in as early as 3:30 in the morning, and they're ready to have anywhere from 30 to 40 collections in about 2 hours. So it's they go room to room collecting patients. After their morning run finishes, then they're to maintain their floor throughout the day, and the process is a lot slower. But yes, on a typical day, I could say about 30 to 40 patients.
So after they're done drawing the blood, who do they take this sample to?
Okay, so after they're done collecting their blood, they're only allowed to draw 3 patients at a time. They cannot batch the samples, and batching the samples meaning let's say they have 5-10 people to collect. They can't wait to finish their 10th collection, because that's just delaying the process for the specimens. It does no good that, let's say, a doctor ordered something stat, like that he needs results right now, like and you go and you collect your next patient, you're holding on to them, nothing's happening with that sample. So the cool thing about DHR is that on every floor, we have a pneumatic tube that shoots down to the lab. So what you do is you get a little bullet, you put your blood in there, and you send it to lab. So you collect your 3 patients, you send them. You collect your 3 patients, you send them. Of course, there is challenges sometimes where there's no tubes, or maybe the pneumatic tube is not working or something like that. But in that case, when your pneumatic tube is not working, then we have somebody help them out, walk the samples to the laboratory. So yes, you collect your samples, you shoot them to lab, and they go to lab for processing.
Can you talk a little bit about the outlook for phlebotomists at the hospital or any other location? What kind of job openings are available for phlebotomists?
Well, right now, there pretty much, there is a lot of opportunity for phlebotomy. Basically anywhere. There's nursing homes that require phlebotomists. There's doctor's offices that require phlebotomists. Hospitals require phlebotomists. There is a lot of different areas that that they will hire a phlebotomist. Like, I don't know, but maybe not a lot of people recognize the lab, but we're frontline because without a lab test, there's no lab result and there's no diagnosis. So our job is very important.
Hello, Samantha. I see you joined us.
Hi. Yes, I'm sorry I'm late. It's because I had another Zoom meeting right now.
It's okay. We are recording this, so I'm going to make it available as soon as we're done. Ms. Nell has shared a lot of awesome information. Do you have any questions about phlebotomy that she may be able to answer?
I guess as far as using the butterfly needle, and like I know with Miss Conde and with Miss J, we had to learn how to use it on the hand. So maybe doing that one, and how to like as much, I guess, less pain as you can for the patient.
Okay, so we're talking about less pain. The less pain would be on the antecubital area. That would be, the less pain for the patient, and usually in the hand is a lot more painful. But yes, we do use the butterfly method on the hand. We don't use straight needles or anything like that because we don't want to bruise the area. Okay, so if you'd like, I can do a demonstration on the hand. The only thing is that I do not have another butterfly needle because we discarded that. So so what we can do is we can go ahead and use, since we haven't done the syringe method, we can go ahead and do the syringe method. The syringe method, I do recommend it for people that are a little bit more experienced because you have to make sure that your hand is firm and you're not shaky and you're not moving it, because if you do, then you either go out of the vein, you know, and you may cause a hematoma on the area. So you got to be really precise and very careful with your syringe method. Okay, so let's go ahead and show you guys the syringe method. Okay, so this is a syringe, and this is your needle that you're going to attach to your syringe. Okay, you're just going to screw it in here. Okay, make sure it's secure. And like we talked about before, this is your safeguard. Okay, so let's get ready to, okay, so you put on your tourniquet, you get your gauze and your alcohol. Okay, you kind of feel for your vein. Okay, so I see a vein right here. Okay, so you apply your alcohol, you let it dry. Okay, because you, like I said before, you want to make sure that it's dry so that once the needle goes in, it's not going to sting the patient. Okay, so this is your safeguard. So you pick this up and you remove your cap. This is your needle. Okay, so you remove that, bevel up. Okay, so you feel your area again. Okay, it's here. So this one has to be flush. You don't have to, this one, you know, you don't want to pick it up too high or anything. So the angle is just flush to the skin. So there it is. You put it in there. Once you see, on this one, the cool thing about this one is that you'll see right away when you get a flashback. You see a flashback, okay? So you kind of pull it very slowly. Slowly, 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 slowly. Okay, you don't want to pull too hard because if you do, you're going to blow the vein. And once the vein blows, then you're not going to have flashback. Okay, so you'll just go very slowly, 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 depending on how many cc's you need, then you stop. Okay, then if you're done collecting what you need, make sure you remove your tourniquet. Okay, then you get your alcohol and your swab, you apply it on the area, you remove your needle. First thing you want to do is make sure you put your safeguard. Okay, sharps are supposed to, you're supposed to always make sure you use your safety nets. So sharps, get rid of them as soon as you can. Okay, so you set that down, you apply pressure, you make sure that the patient is not bleeding anymore, you assess the area, no, it's not bleeding, okay, then you're ready to tape it. Once you tape that, you apply your tape on there. Okay, now, this is already a dirty needle. You need to dispose of that. You make sure you unscrew this, okay? This goes in the sharps container. So now you're like, okay, so now what do? How do I transfer the blood to the appropriate tube that I need? Okay, so we have this little hub here. This is a pink hub. You open this up and it attaches on here like so. You attach the syringe in there. Okay, so once that is attached, you're ready to inoculate whatever tube you need. So let's say it's a CBC or a Chem 7, chemistry studies, whatever you need. You're just gonna insert them in here And like magic, since it doesn't have anything, it's not doing it right now, but if it had blood, like magic, it just transfers it in the tube. Once everything is transferred, you remove this, it's sharp, make sure you dispose of it, okay? So that's how you use your syringe method. Does anybody have any questions?
I have another question.
Uh-huh.
What do you do if you are unable to find a vein for a patient, like on the anacubical or like wherever?
Right. I know that once you're fresh at this, you know that you're always gonna come into challenges where, okay, I don't feel a vein, I don't see a vein, or stuff like that. But here in DHR, there's veins. You will always find a vein. You know, sometimes you have to do little tricks here and there to find a vein, to make the vein come out. You have to have your patient pump the fist, you know, several times, you know, keep on pumping the fist. What you do sometimes is you use a double syringe method. So you apply one on the upper area and on the lower area of the arm. And once you do that, okay, so let me show you. So what we can do is we apply the double method. So you put a tourniquet on the middle of the arm and you apply another tourniquet on the lower area. And what you do is you start feeling and you start kind of like tapping the area and stuff to make the vein pop out. You apply alcohol and stuff like that. You look, sometimes it's just patience. Sometimes, you know, you're busy, whatever, you're in a hurry, you go and you don't feel anything. So, but here at the hospital, 2 shots is all you have. You can stick your patient once, look again. If you see that your patient, you see something, then go ahead and do your second attempt. If you still can't find anything, then you call for assistance. There's always people here that are more experienced than others that can go and help you and find the vein that we need. We run into that every single day here in the hospital. So I'm very blessed that I have a great team. So my team is always a team player and they're always helping each other out. On every shift, I have 3 shifts and there's a lead tech on each shift. And usually that's the to-go person when they have a difficult job. And sometimes among themselves, you know, they know who's a little, has a little more tricks or a little way of finding, you know, the veins better than the other, and they'll reach out to each other for help.
Is there a special population of patients you would say that there's more difficulty in finding veins?
Yes, and that would be the geriatrics. And why? Because the geriatrics sometimes are in and out of the hospital. And so they have hematomas in different areas already. They've been stuck so many different times. So they're receiving a lot of fluids. So sometimes when you stick the needle, sometimes you insert the tube and you see just a lot of fluid coming out. And that's just because the patients have been here too long and they're receiving a lot of fluids and stuff like that. But yes, we do have little challenges here and there every day. But we've learned to overcome every single one of those just because we do this so much every single day, every single time.
I have a question. I'm not sure if everyone knows this, I joined late, but how do you know you ruptured a vein, or like what do you look for? And then if you do, how do you like not treat it, or what's the next step?
Well, sometimes you'll know right away, because when you go in the vein, you'll see like their skin. You'll start seeing like purple. It'll pop out right away. Like it'll start getting purple, and that's when you know, okay, you know, you busted the vein. So once that happens, my recommendation is just pull out and assess the area, tape it up, and find another area.
Okay, thank you.
And when things like that happen, do you make a report, or who do you advise, just so that there's precautionary measures for the patient?
Yes, anytime that happens, you always want to have close communication with the nurse. You notify your nurse, you let her know, you know what, I went and I did this patient, I wasn't able to do it. And, you go show her the outcome, she'll assess the area and then she'll take it from there. She'll say, okay, you know what, we're going to apply a warm cloth and stuff so that the hematoma can spread, and it'll be, the majority of times it's just a little small hematoma, and with a little hot compression or something, it'll subside.
Okay, thank you.
Okay, so I think we're about at time for our session. Those of you that joined us late, it's okay. I recorded, and so you'll be able to see it from the beginning. She's got a lot of information, so I really recommend you watch it and you share with your friends. And you have plenty of time now that you're home, right? We can do a lot of stuff in the comfort of our own home. Unfortunately, this is our situation, but we're going to make the best of it. And I want to thank Ms. Snell. Thank you so much for providing your expertise and all the information you gave our students here and our educators from the region. And I want to thank DHR and Region 1 Education Service Center for providing these opportunities again. And we will have more. Our PATS project is still going. So the good thing is we'll be able to provide a lot of these videos for you guys so that you can continue watching and learning. And we wish you the best. Thank you again, Ms. Snell. And we will see DHR soon again for the next video. Thank you so much, everyone. And stay safe, stay home, wash your hands. Bye-bye.
Bye-bye.
Bye.